Your cholesterol level has a major impact on your health. Phoebe cardiologist Dr. Karup Arunashalam is here to talk about everything cholesterol. So let's start with the basics. What is cholesterol?
That's basic questions are always tricky. Cholesterol is nothing but a fat molecule produced or synthesized by animal cells and human cells. Cholesterol plays a major role in maintaining structural integrity of a cell, repair of a cell, maintaining normal brain function, nerve function, and it also plays a role in producing steroid hormones.
So we often hear about good cholesterol and bad cholesterol. What does that mean? What's the difference?
So, based on the blood test called lipid panel or fasting lipid profile, we categorize the total cholesterol level as high density lipoprotein or HDL, low density lipoprotein or LDL. So, HDL is called as good cholesterol, LDL is called as bad cholesterol. The function of HDL is to transport the cholesterol to liver so that cholesterol is eliminated from the blood. The function of LDL is to transport the blood cholesterol to the peripheral tissues and also the liver. The peripheral tissues include brain, heart, muscle, and extremities.
So if that LDL or that bad cholesterol level is high, what kind of health issues can that cause for us?
The LDL cholesterol is called as atherogenic because it affects the blood vessels, mainly the large blood vessels and the medium-sized blood vessels. So every organ has a blood vessel. Once the blood vessels are affected, it can cause end organ damage like stroke, heart attack, and sometimes like kidney problems, gut issues, and also you can develop blockages in your extremity blood vessels, which we call as peripheral vascular disease.
Are there symptoms before something major like a stroke or a heart attack that may indicate that our cholesterol is too high?
Unfortunately, just like diabetes, high cholesterol does not cause any symptoms per se. Once you start noticing end organ damages, which includes, as I said, stroke or a heart attack, you develop symptoms. So that's why it's very important to start screening for cholesterol level after a certain age.
What are the risk factors of high cholesterol?
We classify the risk factors or the causes into two. One is the primary cause, which is basically genetics or familial, which is not modifiable. The secondary causes are the common causes we come across, basically diet habits, lack of exercise, sedentary lifestyle, sometimes medications, sometimes inflammatory disorders, HIV can cause elevated cholesterol.
You mentioned earlier the screening. How do you actually go about the screenings? Is it just a blood test? And how often should we have that screening?
Yeah, so blood cholesterol can be measured by blood test called lipid panel, and primary care doctors and cardiologists or internal medicine physician can check your blood cholesterol level. There are various recommendations by different societies. The main one is United States Preventive Services Task Force. They recommend screening after age of 35 in men and age of 45 and above in women. For people with risk factors, it's good to start screening at the age of 20 in both men and women.
So what is a healthy level? What is there a goal that we should be striving for?
It depends on the risk factors. The ideal LDL level in normal healthy individuals should be less than 130 milligram per deciliter. Patients with history of heart attack, stroke, diabetes, and vascular disease, LDL level should be less than 70 milligram per deciliter.
So what is your best advice to help us achieve and maintain a healthy cholesterol level?
It's a good question. Mainly first the screening test to be done by the physician, and starting with exercise, like leading an active life, avoiding sedentary lifestyle, which is being inactive for nearly 7 hours or more in a particular day. The other thing is practicing healthy food habits, more greens, more vegetables and fruits, avoiding animal fat, saturated fat, avoiding trans fat, avoiding deep fried foods, and daily exercise of at least 30 minutes every day or 150 minutes in a week. And after practicing all these lifestyle changes, if your blood cholesterol is still high, there are medications which can lower your cholesterol or which can prevent absorption of cholesterol from the gut. The main one is the statin group of drugs, which can help lower your LDL or bad cholesterol level.
And those drugs are very effective, aren't they?
So yeah, they are very effective. Some of the studies say if your LDL bad cholesterol level goes down by 40 milligram per deciliter, the risk of cardiovascular disease goes down by 20 to 22%.
Dr. Arunachalam, thank you so much for sharing your expertise with us and helping us know what we need to do to maintain a healthy cholesterol level.
Thank you very much for the opportunity. It's a pleasure to create some awareness in the Cholesterol Awareness Month.
Great, thank you.
Thank you.